My name is Kara Roncin. I'm a dual board certified anatomic and clinical pathologist working at CHI Health, which is a member of Common Spirit Health. And I also hold clinical instructor at Creighton University School of Medicine here in Omaha, Nebraska. So I chose surgical pathology as my specialty because as I was going through medical school, I actually didn't think I wanted to be a pathologist. I was very focused on general surgery, eventually focusing on urology, and pathology really became my backup since for me, spending time in clinic and on the wards wasn't really where I felt that I thrived. So I had applied to a few pathology programs. I was on my pathology elective, so to speak, realizing, okay, I actually miss textbooks. I miss being at the microscope, and at that point, that was about the first thing I was thinking of. Going through residency, you're exposed to all different aspects of pathology, and for me, it was, okay, I went in, I'm like, yeah, we're going to do genitourinary pathology, which is the pathology counterpart of urology, and that second week of breast pathology, I was like, nope, breast path. Still love my GU, but breast path is really where my passion lies. So I've had the advantage of working in healthcare in both Canada and the United States. I'll start with talking with Canada. As far as pathology, they're actually structured very similarly. The residencies are similar, although for those that may be interested in clinical pathology, a lot of that is split off. So instead of doing a general residency program and then subspecializing for a year, you would do an entire residency of microbiology or clinical chemistry. So in that way, training is a little different than down here. It also is a 5-year program in Canada, where it's 4 years in the United States for general pathology. So for, again, those that are coming maybe from Canada to do residency in the States, that's why you have the additional ACGME fellowship year requirement, because they want you to have the same equivalency to what they are training in Canada. I think what I went from in training, med school and residency and beyond, where it was, okay, I'm going to be a pathologist and this is what I do. Now I look at the broader picture and I go, no, I need to bring in my clinical friends. I need to bring in the nurses on the floor. I need to bring in the administrative faculty as well, and compound that too when you look at, I'm working with medical school as well, because in the end, we are all on the same team and all of us want the same thing, which is you want the best care for your patients. We want our residents and our fellows to receive optimal training. And we can't do that if we work in our little silos. So by little, I just mean like very subspecialized and structured. We all need each other, and part of the work that I do is in breaking down those barriers and trying to get us to work more on the same team. In order to remain on the cutting edge of medical knowledge, we have to constantly be learning about things, and pathology is no different than any other medical subspecialty. Whether it's through research or collaborative efforts, we're always finding that, hey, there is a new marker that works, or we thought these things were important to report and now we know that they're not significant, and these things that we didn't really pay attention to, now we know we have to. All this comes through with pretty much the large clinical trials that the clinical friends will run on their end of things. So what that means is pretty much any day of the week, you're probably going to catch me in my office. I'm listening to a podcast. I am signed into a webinar. I am constantly reading journal articles. Now, the journal articles that I read tend to be focused on my areas of interest. However, if I'm looking at a case and I'm not quite sure what I'm looking at, I go digging for the articles and I make sure that, okay, I'm learning the features or revisiting features that maybe I'm not as fresh on. And then additionally, pathology in medicine, which is a small field already, we have the benefit of having colleagues across the nation, around the world, that know a little more about something than I do. Maybe they've seen more cases than I do. So I always have that option of reaching out or phoning a friend and saying, hey, can you help me out with this? What can I learn from this? And across the board, you will never find someone who says, oh no, I don't want to look at that. Oh no, I don't want to take the time to show you that. So then I just try to recapitulate that myself with when I have a colleague come in or I have a resident come in with a question, because there's always something that we can add to someone else. In giving back to my community, this is done in a couple of different ways. Obviously, a lot of it is focused on the medical community by virtue of the work that I do. I focus a lot of my effort into teaching. So whether it's residents, fellows, not necessarily in my department either. We have our medical students at Creighton University, and also colleagues outside of pathology. So I can do that either by direct lectures, case-by-case basis if they call me, and sometimes I even have patients call me that have questions about their cases. And one of the other things that I've done was during residency, I actually developed an after-hours teaching program that, at the behest of another pathologist, I actually started recording it, and it went on YouTube, and we had worldwide audiences logging in to attend these live sessions when I had those. I also did sessions where it was just me at the scope talking about cases, and being able to bridge that gap between not just the people immediately around me, but literally anyone in the world was so humbling and empowering at the same time too, that, you know, the things that we say and do matter. And I think for me, having patients that have watched my videos that reach out with extra questions, I think it also is telling of the times that we're in, where everyone has so much access to knowledge. And the fact that you have cancer patients that go, hey, this is my tumor and I want to learn a little more about it and how it behaves, I think is really awesome, actually. As far as society, I volunteer with a number of things. I also am like a regular blood donor. So when I'm in the U.S., that is with the American Red Cross. If I'm back in Canada, that's with Canadian Blood Services, and I'm also registered as a marrow donor there with them. I participate in pretty much any charity walk that I can attend. Money never goes to a bad cause in my mind. And then I also am working with some of my clinical colleagues on more collaborative efforts between pathology and the community. There's a huge disconnect between a patient getting a report and understanding what that report means. So I think there's a couple of ways we can do that, and that is something that I'll be working on in the future to hopefully bridge that gap for a few patients. For the future, I have a lot of plans. Some probably are considered goals, but the biggest thing is the pathology community relations projects that I have in mind, and some of them actually are in their infancy right now. I really would love to see those realized. Some of these are ideas that I've had since first year of residency, and how we can really connect with our patients. I am always doing a lot of research, so my research focuses heavily on quality assurance initiatives. Right now we're doing a lot of cost analysis, trying to figure out, okay, is everything that comes through the lab necessary? How are these things being reimbursed? Are costs being pushed back onto the patient? We're really trying to figure that out so that we can give the best care possible without it hurting the bottom dollar for our patients. I also have a number of biomarker projects in the works as well. So I guess a future goal, since we are starting to work on it, would be obtaining an NIHR grant. Really is the goal, so that we can do a lot of research and instead of just a little bit of research. And then apart from that, I have looked into a few more advanced degrees, whether that's an MHA, MBA, or even a Master of Education, since I am so involved on the education front. And then, you know, on top of that, everyone wants to go through their career feeling that they do everything to the fullest and that they are a good purveyor of their profession, so to speak. So I really would like to continue doing that and educating my residents, which is a big reason why I'm here at CHI in Creighton, is because I love having residents. I love having medical students, and doing more mentorship with them. So outside of work, beyond community initiatives, like bridging the gap from pathology and art therapy, I actually am a very avid board game enthusiast, and I do spend a lot of time with, at the moment, daycare initiatives as part of family time, and then a lot of the community events as well. So be it volunteering for walks, or if I know there's an educational event going on, it's how can I help, how can I be of service. So just trying to keep things going all the time. The experience that I've had that taught me the most, honestly, was going to medical school. I went to medical school on the island of Nevis at Medical University of the Americas. So I went down to the Caribbean by myself. I didn't know anyone when I went there. It was a totally new experience, and for someone who is innately very introverted, I actually had to become an extroverted introvert for that. And part of that was natural progression, where I was interested in, okay, let's join American Medical Students Association, the AMSA chapter, let's get that back up and running. And that was, you know, I'm not going to admit how many years ago, but I was in good shape, and I did actually start like my own workout program that other people were like, hey, you're seeing results, we want to do this with you. So then I was doing that, and kind of just any sort of initiative that I could to put me with people and really develop my medical family that now just keeps expanding every time I go somewhere, and I love it. And then on the personal side of things, without a doubt, becoming a parent teaches you everything. You go through so much of your adolescence and your young adulthood thinking, oh, I have all the answers and my parents didn't know anything. And you learn very quickly once you become a parent, whether it's, you know, a parent, or you become, you know, a parent to a fur baby, that no, they have their own ideas of how things are going to go, and you have to learn on the fly. And more often than not, it's going to end up with a, yeah, Mom, Dad, you were right about everything. Over the years, there have been a number of noteworthy events that have taken place while I've been in training, in practice. The most notable as far as training would have probably been the major switch from a law programs going from general sign-out, which ironically enough is what I currently do, but general sign-out being you do everything. So if there's GI, ENT, GYN, you're doing all of it at the same time. And when I started residency, a lot of programs had really just started to shift into subspecialty sign-out, which is how I train. So if I was doing breast cases, I am signing up only breast cases, and same for all the other specialties. So in that way, my training afforded me the ability to really hone in on a lot of diagnostic subtleties. Now, does that in any way imply that it's superior or inferior to general training? No, it's just different. And I appreciated it myself because I liked being focused on one area at a time. So I do know that as an attending, I tend to kind of group my cases together where it's like, okay, let's look at the GI cases, let's look at the GYN. And for me, it's just a little easier to try and get that but it's difficult to describe. But when we're looking at cases, there's certain patterns I'm looking at and certain thresholds. So if I'm looking at all of those together and again, it's easier to teach it to someone else. Hey, this is that little thing that we missed on the first case. Well, now you're getting it, and then we get to reinforce it. So for my style of teaching, it just tends to work a little better. One of the other, I suppose, most historic things maybe with regards to pathology would definitely have to come during the COVID pandemic. Everyone was called in to do things that were outside our scope, outside of things that were not necessarily, okay, this is what I'm training to do. And for myself, I got a call. I remember this. It was a Sunday afternoon, and I happened to see I had a page from an attending, and I was like, I'm not on call. Why are they paging me? And I'm like, you know what? I better answer it because maybe they thought I was on call. And here, my love of spreadsheets had been mentioned, and they actually had me produce within that day an entire schedule for all the non-pathology residents to assist with doing screenings, temperature readings, those kind of things at the door. So I had to learn in literally a couple of hours how all these other areas, how they structured their rotations, which residents could be pulled at certain times, and then communicate that with those residents. So I was able to turn that around to them within that afternoon. And so that was my contribution to the COVID effort at university hospitals. But it really taught me a lot about how effective you can be when you're looking at risk-taking strategies and how much you have to communicate with other people. If it was simply just making a schedule, that would have been easy, but I needed a lot of other people to provide pieces of information that I simply didn't have. And thankfully, everybody was very responsive to my requests for information, and we were able to get everything up and going without anyone missing a beat. So I've actually benefited a lot from being associated with Marquis Who's Who, from the absolutely stunning plaques that right now are all over my living room, family room, to being able to connect with people worldwide, which is, it's insane. I love it. Like I say insane like it's a bad word. No, it's an amazing word. Being able to reach out and say, hey, I know this person from this area, and oh my goodness, so-and-so has read about me, and they find that inspirational. That is so unbelievable. Just earlier this month, I was listed up in Times Square of all people. I mean, I come from a small town of about 600 people, and to think I was up on the Midtown Financial billboard in Times Square, that is absolutely awesome. And I feel like everything just kind of keeps going. You know, I don't know where this journey ends, where the ride stops, but it is so exciting to be on it at any point in time that I'm like, I don't want the ride to stop. So, but I'm really excited to see where things go and how things progress in the future. Being a Marquis listee means that a group of incredibly influential people across the nation, across the globe, know who I am, and I am considered to be equal among them. The very idea is awesome, epic. I don't think there's a word that's big enough for that. But to have all this happen and be so early relatively in my career is humbling, and at the same time it's proof that what I'm doing is working and that I should keep doing what I'm doing. And when I find projects or issues that I want to press, that I should continue to do so.